I'd like to thank Dr. Anawat for finally coming to Calcutta. I've been pursuing him for a long time, and I wish everybody a pleasant conference. Now, the incidence of infection is on the rise because of the number of surgeries that are being performed, and it's projected to reach about 6.8% in 2030. Now, the aim of our treatment is to eradicate the infection, alleviate pain, and restore best function. Now, mind you, amputation may be the end stage in this game. Now, in the investigations, joint arthrocentesis and isolating the organism forms the most important task. Now, what are the treatment options that we have? And of these, I'm going to talk about the single-stage revision popularized by Dr. Freeman from London. Now, what is the principle and rationale behind the single stage? It's to render the knee sterile by a combination of surgery and antibacterial agents. And you have to implant a new prosthesis covered with antibiotic-loaded cement, as you've just heard. Now, the interval between the two is about 30 minutes as compared to 6 weeks of minimum interval in a two-stage revision. Now, what's the principle again? Instead of antibiotic-loaded cement spacers, we are using chemicals like povidone iodine-soaked swabs in the wound to get it sterile. But first of all, you must have a very meticulous debridement, and it must be followed by a period of exposure to a sterilizing agent which is sufficient to sterilize surgical instruments. And then probability we'll get the field sterile. Now, what are the possible indications? I would say not a late infection, but about 3 to 4 weeks of infection. You must have good soft tissue status for a primary skin repair. Microorganisms ideally should be of low virulence, and there must be a good host immune status. Preoperative considerations: patient should be fit for a prolonged surgery because this takes about 3 to 3.5 hours. You're doing everything in the same sitting. And we must have, as I said, arthrocentesis, we must have the bacteriology and the culture, and we change the prosthesis if it is loose. Now, a single sinus does not preclude surgery. And as I said, we must identify and find out the susceptibility of the organisms. Presence of multiple organisms may cause problems with this procedure, and we should reduce the skin and tissue edema as much as possible. Dr. Freeman recommends that you stop antibiotics 2 weeks before the operation and restart after you get a culture report during operation. Now, it's contraindicated if a patient is unfit for a major surgery, if the skin condition is not good and you can't do a primary closure. If there are multiple sinuses, you're not going to make good with this process. If there's a marked cellulitis, again, you're going to have problems. And if the patient is immune compromised, then again there are problems. Now, what is the operative procedure? The first part, you give the incision, and without excising the soft tissue, skin edges, then you remove the prosthesis, especially if it is loose, and you remove and do a proper debridement. You remove all the synovial tissues and membranes. In the second part of the operative, this thing is the meticulous debridement. I'm repeating it again and again. It must be very meticulous. You must have clear bone surfaces, and you must use a curette and this pulsatile lavage. In the second part, the knee is packed with povidone iodine swabs, and you close the wound and leave it for 30 minutes. Then you come back, you re-drape it with fresh instruments, you do another surgery, and you implant the new prosthesis. And it's better to use the appropriate antibiotic in the cement. Now, if you review the literature, it's not a bad procedure. 9 to 11 here, this is the worst that I came across, 42% failure, 73% success rate, and 75% success rate. And this is the best of the lot, which says 94%, but they are using antibiotic-loaded bone grafts by impaction technique and an uncemented prosthesis. Now, mind you, I would again say that two-stage revision is the gold standard for care for the infected total joint. But this is the meta-analysis of both the procedure. 73 to 100% success rate with one stage, 82 to 100% in the two-stage procedure, with the added advantage of lower cost and duration of the treatment with the one-stage procedure. And in conclusion, I would like to say, for a good result of the one-stage procedure, you must have organisms of low virulence, good skin condition, and patients should be able to tolerate a surgery for 3 to 4 hours, but must have a thorough debridement and chemical sterilization to render the knee sterile. Thank you very much for your kind attention.